COPE today. For anybody who doesn't know me, I'm Amanda King. I'm the Lead Commissioner for Early Years in Warwickshire. I'm joined by Jane Copes, who's going to give us our update, and Dawn Jeram from our advisory team. So, Jane, have you got your links where you want them?
I have, but regular attendees at this meeting will know that I tend to put some things in the chat column. So everything I'm going to refer to now is already in the chat column. So you should just be able to click on them or look at them at the appropriate point. I can see that Nadia is typing. So I can see that we've also been joined today by Nadia Inglis, consultant in public health. So I'll do my presentation as normal. Hi Nadia, it's lovely to see you. I didn't want to assume you would have the time to join us today, but obviously between my presentation and Nadia being here to chip in any really fresh updates, etc., hopefully we'll be able to give you a really good briefing today. So if it's okay with everyone, I'll start as I would normally. So good afternoon to everybody. I hope you're all well and finding a way to cope with the terrible weather that we're experiencing at the moment. It really doesn't feel like much of a summer, does it? And I expect those of you with outdoor play areas are really struggling to keep on top of the constant showers and downpours. As you can see from the number of new faces here this week, Sonia, Jessica and Fidelia are all away. So I'm probably the only consistent link to the briefings that you've had in recent months. And so thank you very much to Dawn, Amanda and Nadia for being here today. As Amanda's already said, we'll pick up any outstanding queries that we can't cover today in the early years briefing, so you will receive that. I've popped my usual two graphs in the chat column. So if you remember, double click on each graph and it'll expand so it's easier to read. The grey horizontal bar chart shows you the latest 7-day case rate information available for our district and borough areas in Warwickshire. And as you'll be able to see, Nuneaton and Bedworth is currently top of the list in Warwickshire at almost 285 cases per 100k of population over the rolling 7 days. North Warwickshire ranks as the lowest at the moment, almost 233 cases per 100k. To be fair, we're experiencing a period of fluctuation, as I've mentioned before, and only 7 days ago, North Warwickshire was actually the highest rated area in Warwickshire with 265 cases per 100k. So the takeaway point from this really is that COVID's presence in our communities continues to shift. It's very changeable and is showing a pattern of slow growth. You can see this slow growth more clearly in the pink bar chart, where if you look to the right, you can see a new climb in the overall numbers following what was a very steep drop off. Broadly speaking, this pattern was predicted given the change in restrictions, and government has been clear that we should expect some continuing instability while we vaccinate more people and we return to pre-pandemic ways of working and living. Public health services are very much learning as we go, given the unprecedented nature of what we're all still going through. The number of people in hospital continues to be a matter of interest. There's a slow increase in the number of people being hospitalised with COVID nationally, and this is reflected locally as well. Most people in hospital with COVID have not had both jabs, and the age of patients is dropping, with people in their 20s and 30s represented in the data. Please help where you can by continuing to promote vaccination to those who have not yet taken it up. Government messaging continues to promote the availability of testing, NHS test and trace, isolation and quarantine for some returning travellers. The restrictions under which we've lived, such as social distancing, face covering and hygiene, are now recommended rather than required, with responsibility for assessing risk sitting with individuals. And to be honest, I expect that we'll see many more queries due to this grey area, given that individuals are likely to have different views on risks and the appropriateness of applying different types of thinking within different scenarios. You'll all be aware by now that the 16th of August sees the introduction of more changes to England's COVID measures, with significant relaxations, particularly in relation to self-isolation. Colleagues are working hard behind the scenes to prepare local supporting information for the government-led changes. And what I would ask you to bear in mind is that we receive the government updates at the same time as you. Unfortunately, we don't have prior access to that information. So that means we need time to assimilate and amend the drafts we've got to make sure that everything is absolutely aligned. So if I could therefore ask for your patience and understanding, particularly recognising the fact that colleagues at the County Council end will be working flat out to get this information out to you. If you have a truly pressing need, I can honestly say your quickest route to getting that information will be to read the relevant documentation on gov.uk as it comes out. Otherwise, you need to give us just a little time to get ourselves on top of the game. In development is a Warwickshire Outbreak Management Guidance and Template document to support early years and childcare settings. The purpose of the document is to support you to respond to single cases, clusters and outbreaks going forward, and it will gather into one place all of the relevant government guidance links and provide you with a framework to help you check off your local measures and set out your approaches. The guidance document will also cover contact tracing recommendations, and the form you use to report positive cases to public health will remain in place. Changes to self-isolation rules mean that close contacts who are double vaccinated or under 18 will only have to isolate if they test positive or have symptoms. And it's suggested that those close contacts take a PCR test, but it's not going to be required. Isolation rules remain for those with no or one COVID jab, and I foresee this being an area of confusion for some going forward. Lateral flow testing for people without symptoms remains in place nationally, and twice weekly testing is still widely encouraged for all. Do remember that boxes of tests are available free by online order or at many local pharmacies, or indeed if you happen to be in Nuneaton or near, you can call into our test site at Nuneaton United Reformed Church to get boxes from there. Moving on, colleagues across early years, the Education Corona Helpline and the Public Health Duty Desk have been receiving and responding to your queries as they come in. Last week, Public Health supported 3 nursery settings with small outbreaks, but I believe a further 15 settings have reported COVID-related issues and matters over the week. So thank you to all of you for continuing to act responsibly and quickly to limit transmission in your settings. A couple of queries have been raised that it might be worth me talking about in a little more detail. The duty for you to trace close contacts has now defaulted to the National NHS Test and Trace programme, although we've had a number of reports, it's fair to say, that there have been delays in the national team being in touch, maybe as much as a couple of days after people might have expected them to be in touch. As you know, only Test and Trace can direct people to self-isolate. The new outbreak control guidance that will be circulating soon will cover recommendations for you on notifying close contacts of positive cases, but it makes sense to share the final version with you rather than draft content, so I'm being a little bit vague about this by necessity for future clarity. You can quite confidently continue to advise close contacts to take a PCR test, even where those close contacts are children, but this is personal choice rather than something that people must do unless they have symptoms. The other main theme in inquiries is around the 10-day self-isolation period and when it starts for whom. We've got just a few days left under the current regime because it's all changed on the 16th of August. Because there are so many permutations with both household and non-household scenarios, my suggestion is you direct attention to the gov.uk webpage, NHS Test and Trace, what to do if you are contacted, and that's one of the links that I've put in the chat column, so you should be able to get a direct link to that page without having to go in hunt of it. The pattern throughout the pandemic has been that government provides updated guidance on the day it goes live. So realistically, we're unlikely to see the new guidance published around self-isolation guidance until the 16th of August. We had a query from a setting on vaccines for staff. And in this particular scenario, one staff member in the setting was not vaccinated and had expressed a preference not to be vaccinated. Amanda's done some really great legwork around this, and I'm hoping that in fact the link that she identified to the ACAS website with some useful information is already in the chat column there for you. Ultimately, there's no legal requirement for staff to be vaccinated, so please do look at the ACAS guidance to understand what avenues are open to you and to inform your approach to those conversations with staff. A quick update for colleagues in North Warwickshire on PCR testing, which is the test for people who have got COVID symptoms. The test site in Atherstone, which has been at the Woolpack Way car park for quite some time, was taken down at the weekend. And so the closest in-person symptomatic testing service for North Warwickshire residents is now either in North Warwickshire, or is either in Nuneaton or at the NEC. We're working with the Department for Health and Social Care to try and secure another site in Atherstone, and I hope to be able to tell you soon that symptomatic testing has returned to the borough. But in the meantime, for anyone who can't travel, PCR tests can still be ordered online. I'll close this briefing with a reminder of the help and support lines available to you. So the Education Corona email address is, as always, your first port of call. Please remember that due to annual leave, the summer hours of operation are 9 till 2 on Monday to Friday. The early years advisor team is available Monday to Friday during normal working hours. And as a quick reminder, please email the team inbox rather than individuals, because they may be either on leave or out of the office. Finally, the Public Health Duty Desk offers an out-of-hours service for when those other avenues are closed. They're available until 8 o'clock each weeknight and during the days on Saturday and Sunday. Just a quick reminder to you really that obviously it's the summer holiday. We have quite a lot of staff out on leave or working slightly different hours to what they would normally work. So we've got some staff who are covering extra because their colleagues are off, etc. So we aren't in a normal working period, if you like, at the moment. And colleagues who are working are really willing and able to help as much as they can. But of course, they can't be on call all hours. Please do give us a little extra time to respond to your emails. Someone is picking them up and will filter out those ones that are urgent and get back to them more quickly. But I promise you, everyone is working extremely hard, and we're all very grateful for your support and understanding as we continue to work through the pandemic. So I can see that lots of messages have been popping up, but I haven't been following them. I think it's probably time to move on to questions now. So Amanda, is it worth passing to you to see if there's any particular things that have come up and a sensible order for us to take them in?
Thank you, Jane. That was really comprehensive. Nadia's got her hand up, so I'll go to Nadia first.
All right. No, thanks ever so much for that. That was Jane. That was brilliant. And I think the only couple of things I would add, if it's okay, to add to what Jane said about the first is about the direction of travel for us, and I think we all know that we're going to have a tough winter. I think we know that the cases are going to go up. We just don't know how high they're going to go up. And that's the big challenge for us. And so anything you can do to keep promoting vaccination uptake amongst your staff and parents of the children that attend your settings is a really, really good thing, and will support you as well. And the second thing, just to clarify a little bit around this, what I know has caused a lot of contention around who's allowed to tell whom to self-isolate and when, because unfortunately, we've had quite a challenging period since the move from NHS Test and Trace being the ones to identify close contacts in schools and early year settings, which is why in Warwickshire, rather than directing early year settings and schools to the DFE helpline, we've said, actually, could you come to us first, to early years advisors, during this time period, so that we can support and advise and essentially complement what Test and Trace are doing by supporting you to identify those close contacts within your setting to self-isolate. We did have a parent who didn't challenge us legally, but put in a complaint about whether we were acting unlawfully. But working with our legal teams, it is clear still in the legislation that NHS Test and Trace and local government acting with others, so early year setting schools can also instruct people to self-isolate, and we do have some wording if you are getting a challenge from parents around that. And I know it's a really sticky topic, but please do just keep coming through to us, because we will provide you with the advice that that you need in what's going to be quite, as Jane said, a challenging time. So I just wanted to provide a bit of and I don't know if there are any questions about that, because I know it has caused quite a lot of anxiety and disruption, hasn't it, in the system. But I think the process has changed slightly. So you come through to early years advisors, and we in public health will be working with early years advisor colleagues as well, where you've got tricky situations. And I envisage come the 16th, as Jane says, I think we're going to have to work through this together, I think, is the in terms of who isolates, who doesn't, because I think we are still awaiting some national guidance. I understand DFE will be producing some additional guidance, which is why we're in a bit of a limbo. So we've got some local guidance that has been developed, but we're also awaiting some more guidance around outbreak management in particular. So just to reflect those two things, and then I'll be quiet, but thanks.
Okay, thank you. Does anybody else want to speak? If you do, or to ask a question, please put your hand up and I will unmute you. Okay, Dawn, is there anybody else in the chat with a question that we need to answer?
There's something about LFT testing. Kerry, you were trying to get some LFTs that were saying you can't get them. You should be able to, shouldn't you still, Jane? Yeah.
Funnily enough, we've answered a query about this morning, actually. Early years settings where they are connected to a school are able to piggyback on schools to retain their order of tests, but actually otherwise early years settings and childminders are now advised to either order LFT tests online or pick them up from a participating local pharmacy. So there isn't currently a mechanism running to ship tests out to settings as they were before. So what I've said to this particular setting, which happened to be in Nuneaton, is if you continue to need tests for your staff, please let us know, and we can try and make an arrangement with the United Reformed Church to supply tests. We do have particular target groups of interest for testing, if you like, and Nuneaton and Bedworth does happen to be one of those areas. But if anyone is particularly struggling for their staff to access LFT tests, do please drop us a line and we'll do what we can to help. But the government guidance does effectively say at the moment that early years and childcare, where they're not connected to a school, it's individual staff members now should be getting their own tests.
I can see that there's another one about vaccination from Laura. So you've got a member of staff who doesn't want the vaccination. Yeah, why not? Yeah, I suppose no, but I bet genuinely it's quite I think people have got such varied reasons for not wanting it. I'll be interested, Laura, in what it is. I mean, we've got lots of kind of comms materials about some of the myths that we know circulate. Sometimes that isn't really enough to change people's minds. One thing we can do, and I think Amanda, you've put in the ACAS guidance. The ACAS guidance is in the chat as well, which will be helpful. The other thing we can do is circulate the two links. One is to all of the drop-in vaccination sites across Warwickshire, well, and Coventry, and also the second link is to all the vaccination sites that you can book into as well, just if access is a bit of an issue. Well, some people do like to just drop in and not go through the booking system and what have you, if that's helpful. But if there are any particular themes or things you think we could do to help you to support staff to get vaccinated, it'd be good to hear from you what the main reasons are. We know there's still a lot of myths circulating around fertility and impacts on fertility, and interestingly, that's one of the ones that definitely is this holds no water at all, and unfortunately we're now seeing quite a lot of pregnant women ending up in hospital, and And Stoke, for example, I think they had 5 admissions to intensive care last week for pregnant women. So I think we're trying to see what we can do as a system as well to make sure that we kind of get rid of those messages, that we're giving out the right messages. I think early on in the pandemic there were some cautious messages about pregnancy, and then it's very difficult to turn that tanker around once those messages have gone out. But just to let you know, but yeah, I'll drop those 2 links in as well for our local vaccination sites, if that's helpful.
Yeah.
The ACAS guidance actually offers some really useful steps to think through about how to approach a conversation with a reluctant staff member, and it does talk about trying to understand what the rationale is, to see if what information could be provided to help understand the benefits of vaccination. So it does sort of break down in that level how to approach someone, and also obviously to be clear that we need to take account that people don't feel that they're being discriminated against. It is quite it's a very emotive topic at the moment. So following that guidance on ACAS is really the best recommendation we can give you to frame that conversation at the moment.
Lovely. Okay. If there are no further questions, we'll put the link that Nadia's just popped into the early years briefing. So if you don't catch it here, it will go out more widely. So key messages today are that some new guidance is coming as soon as it's published. We'll finalise ours, and to keep sending your queries into us at Early Years Advisors, and if we can't answer them, we'll find somebody who can. So thank you, Nadia, for your time today. I'm really, really grateful for that, because I know how many different directions you are pulled in. So it's great to see you. Thank you. Thank you, Jane. That was a fantastic job, really clear. And thank you, Dawn. Okay, we'll see you at our next briefing, which I think is in a couple of weeks, and look out for the guidance next week. So thanks, everybody.
Thank you.